My expectation is fewer people than normal, but I didn't want to skip another week. Last week we had some hearings, and I think this Thursday, I'll probably talk about one of the bills, but this Thursday, Ellen and Maura will be talking about bills and legislation on Thursday at noon. So on their monthly webinar, so which will be great. So and I'm just going to wait a few minutes, give people a couple more minutes to get on, and I'm just making Kathleen Amaral a co-host as I'm talking to you here. Okay, good. So today we wanted to build a theme, and I have a few policy things, but I want to start with Kathleen first. And again, Kathleen will probably wait a few minutes, but I wanted to talk about some of the positive things that have happened, sort of things that have gone well. And in spite of, what we faced, the last, as you guys know that have been regulars, the last 3 webinars, we've talked about a range of issues that people are struggling with, and our hope to facilitate some local problem solving, because that's the only way, right? I mean, policy might be statewide and federal, but when it comes to services, and we have to see that policy gets implemented on the ground, right? And funding gets implemented on the ground. And the workforce crisis has only made that, this COVID pandemic, the results of, even worse, right, in terms of access to people. And I think some of our friends were surprised that we estimated that 5,000 people probably don't have services that typically have services. I'm not talking about, people that are unserved that historically are still trying to figure out what's best. I'm just talking about when you add up the adults who can't get to their day programs or can only get to them 2 days a week, or people turning 22 who might not be able to access services, it really adds up, the numbers. And of course, that's not including schools, which where there's historically been an inconsistency. In fact, I was going to ask you, Kathleen, while you're on, if you hear me, is the school situation any better than what we're experiencing in the adult world, or does it really depend on district, what's going on? Well, she'll answer that in a minute, because I think she just got knocked off her internet. I just see her name not there. So let me start and talk about just a couple of positive things from my perspective, that I've heard about as we've, had these sessions, and also working with other people. One of the positive things that's happened through all this is I do see some 2 areas, family groups working better together locally that I hadn't seen in a long time, just out of sheer necessity. And the second thing was more on the advocacy on the federal level, the Build Back Better Act, and what's going on with that, the potential for it, waiting, for that to get fully resolved, but the opportunity to, again, get some home and community-based services funding that we sorely need. It's not going to solve all the problems, but it's a significant amount of funding that can be used, in terms of a silver lining. And I'm going to ask anybody on right now want to comment on that and on something that they're experiencing. And you know what, I'm not looking for like a super pretty picture, just something of better results, the suggestions you have to get better results, either one, for those of you on today. Okay, I'll keep going. I'm going to ask. I know Lucy Shansky's on with me, so I'm going to nudge her for a second. Lucy, are you able to talk? Okay, I'll tell you what, since Kathleen fell off, Kathleen was going to start and give her story, and when she gets back on, she will. But I want to talk about, I'll do an old story, all right, which I'm going to do in terms of only when this COVID crisis started, we had very bad access for vaccines, if you recall. Remember back a year and a half, we couldn't wait till the vaccine started. And then when they did, which was in January, if I recall, of 2020, people were not able to get the vaccine. Maybe it was 2021, I'm sorry. Boy, the years fly. People at home weren't able to get a vaccine, and people in houses, it was all centrally coordinated. Today, we have mobile vaccinations. We have encouragement for people to go ahead and get the booster, and the accessibility is there. I know I went to just to let you know, I went out of town to a place called Rose Hill Pharmacy in Needham. No appointment was necessary. It's a compounding pharmacy. And I even think it was the owner that gave me my what do you call, booster injection. It was the first time I got there. They had my information on file because I had to show them a photograph of my COVID vaccination card. And I got my booster right there and went ahead and, you know, I think I worked from home that day. I can't remember if I drove back to the office or not. But that was pretty good. And it's something that, you know, if you think about it, and it was only January 2021 when the vaccinations started in earnest. I think the medical folks got it in December 2020. So now that's something to be thankful for. It's not 100% day services or employment services, but it is something in terms of the vaccine. That's people figured out a more effective way to do it. And I prefer, in my case, I prefer not having an appointment. I prefer being able to drive to that pharmacy. And my wife went there this morning, 2 weeks after me, and waited online, but not. She said it wasn't bad, and she got her booster as well. Anybody have any experiences like that they want to share? Kathleen's coming on now, but if I want to give us.
Leo, it's Lucy. Sorry, I couldn't unmute. I didn't really hear the question in the beginning.
Yeah, so I was going to, go ahead.
First, I want to tell you that there's also a pharmacy in Newton Center, which might be closer to you, a Union Pharmacy that is very similar, that you can just walk in and get vaccines. You don't need an appointment.
That's great.
I'm not sure whether, I guess at times there have been lines waiting to get in, but I'm not sure what's exactly happening now. I haven't been by there for a few days, but.
So that sounds like that would be in the center of town where the shops are, Union Street, Union Pharmacy?
Union Street, right in Newton Center, opposite the T station.
Okay, great. That's great. I love that spot too. Historically, when I working for my office, I'd meet a colleague there for lunch in that neck of the woods. We'd always get a Starbucks at that old train station that now, I don't know if it still is a restaurant. I know it got converted to a restaurant not long ago. Thank you, Lucy.
Many years ago. It's been a restaurant for many years.
Well, you can see how far I go back in my memory. I still miss the Pete's in that section of town. So I would meet a colleague, actually Bill Abel from the Arc of South Norfolk, now LifeWorks. I would meet him once, maybe every 6 weeks, and it was a good halfway point. So and he's retired a while now, so that might be why I go that far back. So I'm going to ask, so Lucy, if you're thinking, what we're talking about, things that work, I know you gave some great advice to somebody, I think it was 2 weeks ago, on the whole issue of going up the food chain, right? In terms of trying to resolve issues. And I know I talked to the commissioner recently who felt very strongly, and as well as the Deputy Commissioner Elizabeth Morris, that people really should go, you know, the staff have been counseled to really work through these barriers, and that people should go through the area office, go to the service coordination supervisor, go to the area director, you know, and keep working on a solution with them, because that's the goal, is to get everybody back in. And then in some cases, it's a compromise, right? Because there's not enough staff. So, and I think your advice was really important. I'm going to ask Kathleen Amaral to share. I wanted people to share, look, what's worked, because it hasn't been easy for anybody, right? I mean, I have it pretty good, and I'm at the modest end of it. Hasn't been easy. Just the psychological aspects of some of this. And, you know, I've needed some medical stuff, but nothing like other people have needed. Kathleen, do you want to share a little bit about what it's been like? And your son, Liam, you have 3 kids, and Liam's, what is he, 18? Am I making that up? Or
yeah, he's soon to be 18. So the COVID pandemic, you know, out of school for a very, very long time, and then turning 18, right? Just like, whew, a lot. and I just love that you have this as a topic, because, you know, we're all, you know, as a family member, you know, I'm always like, go, 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 go. And worrying about others, but, you know, thinking about my own family, and what I've been grateful for, things that have worked over the last, I'll say, couple of years now. It's been a test of my ability to kind of sit back and you know, I am a flexible person, but sometimes I, you know, go right to what I know works best. And so it's been a real testament to my growth in sort of sitting in it and observing and being willing to, you know, be open-minded and incredibly flexible, provided, you know, I have the fortune of, you know, having employment that recognizes the value of that as a family member, you know, caring for someone with some significant complex developmental, behavioral disabilities. And, you know, he's almost 18, and Liam is in the sandwich of two, you know, a new middle schooler and a 19-year-old sibling. And, you know, I was fortunate during the pandemic, losing staff due to just not having staff. I mean, for years we've been looking to fill PCA hours, and nothing uncommon to anyone on this call, I'm sure, but and also skills training hours too. He's in the DESE DDS waiver program, and not having staff for quite some time, but then also fearful of you know, before he was able to be vaccinated, fearful of sending him out into the world. But when he was home, and, you know, he has a lot of interests, and he's in that transition age, I was able to utilize his older sister, who was incredibly helpful to me. She had been home. She was the class of 2020.
Oh,
Home,
bummer.
yeah, not, you know, dealing with all of that, but then, you know, finding the joy and the humor in their sibling, you know, rivalries and relationships. She stepped up, and she would help. And so she was his PCA for quite some, she still is on the books, so to speak, when you know, when we need her in a pinch. But had we not had her, and her wanting to kind of step into that role and just naturally taking care of him in most of the ways that he needs it, was just a blessing. And
What would have been like, what if she said to you, geez, Mom, it's nice, but you know what? I'm plugging my computer in. I really don't
yeah,
want to go for this. Would that have left
yeah,
you vacuum, right?
which I wouldn't have, I wouldn't, you know, I'm aware enough that I shouldn't have, and probably wouldn't have been upset, but, you know, needing to, you know, do work, and needing to, you know, he needs that someone near him at all times, because he can, you know, just be unsafe and create, you know, havoc and messes and all sorts of things. And he needs to be engaged, and he deserves to be engaged.
Yeah.
But yeah, I would have been, and I wouldn't have been able to remain employed, I would think. You know, there are a lot of things that would have had to stop, and that do have to stop on occasion. But again,
Well,
24 hours.
you did start actually your hours later. You did not.
Yes,
work as
I
much as you
deferred.
could have, and
Yes, yep.
you said, Leo, you know, let's not start at those hours, because I don't know
Yeah, exactly.
what
You
would
know,
work out.
exactly.
Yeah.
I knew you're right. So I knew I needed that flexibility, and so I had to be sort of forthcoming with that, which I needed. I needed that, and so yeah, she didn't, you know, take care of him for hours on end, but you know, I could take my meetings outside when he was mowing the lawn. He has a strong interest. So I kind of captured those things about his personality that he doesn't always get to do, and we allowed him to kind of do those things, like going out and digging holes in the yard and mowing a lawn that ended up being mud by the end of COVID. But then also, you know, going out with his sister for just long drives, and going, we live in Dartmouth, so we've got, not near me, my neighborhood, but down toward deeper into South Dartmouth, this Paid Narram little village with a beach and water. So it's really wonderful to, he, so I will share one little story and then I'll let others share, but in having her and allowing her to, do things with him, she would take him for rides and then take him out on the beach, where mom originally, with my like rules and my set agenda of what works and what doesn't work, I would have said, don't bring him to the beach. He doesn't like sand. He might have an aversion. He might, have a sensory overload or what have you, or he might run into the water and drown. You go right to the worst case. But she didn't listen to me a lot of the time. Luckily, and bringing him to the beach, for instance, was one. She sends me text messages, a way to kind of be okay with him being out with anyone. I always want like pictures of him. It's just a way of capturing that he's okay, seeing his face. It's like a strategy I use. And so she sends me pictures, and he's with my May, Emma, and Liam all together at the beach. And I thought, oh my gosh, good thing I didn't give her that rule, or she didn't listen to me, because he wouldn't have experienced that day alone there with beautiful water, with his sisters, and just sort of not running, but clearly through the pictures having a lot of fun. So yeah, those are just some bright spots.
The sibling thing I want to jump on, because there was years ago, Marty Krause had done research with someone else, I can't remember the other author's name, on sibling relationships. And she identified a couple of things. When the relationships are good, siblings will try different things, right, that parents are not comfortable with, and you can appreciate that, right, from the protection aspect. But the second piece that was interesting is they're tougher negotiating around what's right for him. So a provider was used to a parent backing off, though some of us on this call do not back off, we're trying not to, but they were saying the sibling will hold people to more account, and I thought that was interesting. That's not always the case, but I do, if there's a good relationship and the person's connected, they know what's meaningful, right? And what's not to their brother or sister, so that's the thing you gain with multiple kids if things work out. And then I know of other situations. I know someone I know well whose brother just never, for whatever reason, right? And it's interesting. We just got a donation from someone else who passed away, who had been a brother of someone I knew, like, I want to say 30 years ago. And I was sort of shocked that we got a donation, because he really didn't have any social relationship with his sister. And I said, well, isn't that interesting? I said, why us? I was really like, and I'll never know, because I was not in touch with the person. I don't know what happened to make him make that decision, right? Or to get him to make that decision. But people, siblings, so there's a journey there. There's something going on, even maybe in not a great relationship, right? Where there's a connection.
Right. Connection remains. And there's something there.
Does anybody else want to connect on this? Because if not, I have a question for somebody else, if nobody wants to jump in. Okay.
Lucy again.
Go ahead.
I could just, I guess the staffing issue is becoming a really major issue in my son's life. He is served by one of the supposedly better providers. Right. But the house manager, because they gave him 2 houses to manage, and he was trying to go to nursing school to become a nurse, he decided he had to leave. He just couldn't handle the new responsibility. And his having that responsibility impacted everybody that lived in both of these houses. There was no time for haircuts. There was no time for doctor's appointments. He just didn't have the time to schedule them, to be able to take the people.
Lucy, one second. I want people to have context. So I haven't seen Matt in years. How old is he? Just, do you mind telling people? Because I do think I was going to ask you about him. Honestly,
he's in his middle 50s now.
That's what I was thinking.
And he has profound intellectual disability, so he requires attention 24/7. He probably is one of the more severe people handled by community residences. And he's been well served. They really try hard. But what's happened now is, because this house manager left, there is no house manager. And now the residential coordinator is having to handle the management of 2 houses plus all 3 or 4 other houses that she has to manage. And it's so hectic. But on the other hand, Matty had COVID and has breakthrough issues because of the COVID. And last week he had 3 medical appointments and another appointment. And somehow they were able to manage it. They're doing it. And so
Wow.
I'm happy that they're doing it because he needs to go to these appointments, and they were scheduled before I knew that there was going to be this issue.
Wow. Wow.
So
So,
it's
so one thing to
it,
comment on that, like, that's something, that's a positive, right? Given the
Yes.
nature of the situation, you have to look for things, your expectations change. We're having actually a special, 2 weeks from now, we're going to have 2 parents and a sibling talk about this and the whole issue. So how do you handle this with staff, right? In an agency when things are this tough, right? Because you have to, as a parent, figure out, okay, this isn't a great situation right now, right? And
Right.
my expectations, I'm just happy, okay, they got him to 3 appointments. That never would have been your mojo, right? Like 2 years ago, 3 years ago, right? Lucy, you would have been like, okay, come on, let's,
right.
is
Let's
he
get do
having
it because
meaningful?
because you were capable of doing it, and it's your responsibility. You must do it. But
Yeah,
I mean, I understood their issues, and we just worked it out. And I happen to have a daughter who is just fantastically involved with
I
my
was
son.
thinking of
So
your daughter when Kathleen was talking of May. That was going to be my question, was compare Matt at 50s to Liam's situation in May's supporting Liam. And I know your daughter historically, right, has been involved
yes,
for decades. And she even worked, right, for a short time in the field. I don't know if
yes,
she
she
still
worked.
does.
She managed a house, and she did direct care for some time. She no longer does it except for him, and so I guess to me, it's so fortunate that she wants to be so involved, and she is so involved.
Right,
But we don't agree always on the care. I mean,
right,
I had an issue a while ago with not allowing him to be in his wheelchair in the van. They wanted him not to be transferred into a seat in the van. I feel it's safer for him to be in the seat. She felt it was safer for him to be in the wheelchair. And finally, I just gave in.
right, right. Well, see now, and that's healthy, right? I mean, I don't know who's right. I'm not taking sides on this one, but I think you guys worked it out. And Carolyn just voiced in and said she's had to stop in to take her son and staff to some medical. So you might have staff coming along, Carolyn, are you saying? If you don't mind piping in, and you'll drive both of them, because just the driving issue and making sure there's accurate information? Is that part of what, you don't have to talk if you don't want to. Oh, I'm driving both. Okay, so that's telling me, it might be a situation where she both would like to be there in case there's questions, but also that the staff may need it to be driven, right? Because people are probably hiring people who may not have the ideal cars, right? Transport for doing this, you know? So that's something we don't think of, right? This would not have
Also, but
happened.
for people who need wheelchair transportation, I don't have a wheelchair van, so there's no way that I could do that. I would be happy to do that if I could, but I
Right,
couldn't handle him at the appointment. I would need staff at the appointment to handle him,
yep,
and I can't transfer him in and out of the car. So
right,
he's got to be in his wheelchair
right. And
and in a van.
that's what Carolyn's saying, like it's both a scheduling issue and van availability issue. So then she steps in. That makes perfect sense now. I get it. I get it. And there's new rules, in the old days, in the Wild West, when I oversaw residences and then went on to oversee a multi-service agency, we would let staff drive their vehicles, and they were sort of, what was it called? Also insured. I don't even remember anymore. But in some cases, I see agencies not allowing for the, personal vehicles out of fear, you know, of what could happen. Who else would like to jump in on this? Lucy, this is great. And I was thinking of Matt and just the whole issue of what you experienced. I might come back to you in a couple of minutes and
Mhm.
talk about what you experienced over the decades, because you and I have, I don't know, I think we probably knew each other before 1991, but I think that's when we got to know each other pretty well. And you were chair of the Government Affairs Committee here for a long time. And we really, I'll tell you, that era the 90s and 2000s was an unbelievable era. And Lucy was one of the board members when we agreed to be a plaintiff on the Rowland nursing home lawsuit in 1999. She and a couple other board members said, well, that's fine, but we need to make a commitment today then that you'll also do a waiting list. And her son was already in a residence, so it had nothing to do with, her personal goals from that. It was the issue of fairness and equity. And that day at the board meeting, I remember that because I said, oh my God, we're going to have two in play. And the Rowland nursing home lawsuit started. And then we talked to, we recruited attorneys. And Bill Abel, by the way, was a key ally in that, as well as several other people later on. We had a steering committee for that. But Don Stewart and, if I recall, volunteer-wise, Michael as well. And then later, Ken Singer and others were part of a steering committee. I don't have all the names on the top of my head, but Neil McKittrick ended up agreeing, and he was at Hill and Barlow at the time, to be the lead attorney in that case. And there's a great article on that, pretty accurate article, in the Case Western Reserve Journal about the lawsuit and sort of that and some other lawsuits. And then it ends with a postscript about getting the funding to implement the lawsuit from the legislature. So anyway, Lucy, I remember that. Anybody else want to jump in about their situation and some things they've had to work through? And because I'm happy to get back into the workforce piece. And I think it's a big deal, Lucy. It's bad when you say to me that, that you recognize it and the healthcare piece, and we can talk about it a little more in the slow devolution of the workforce. But any other things about what's worked for folks? And as Carolyn shared, she's been driving to appointments. How about for those of you during the day that are barriers, and know if people have overcome those? If not, I'm going to get into a few more things with Lucy and Kathleen. I know Kathleen feels like her audio is not great. She had texted me. She's going to log out and come back in. All right, so let's just, for the time we have left, we've got about 10, 15 minutes left. I would like to talk about some positives in the past few years, we could go back to explain about how and we might, but let me first talk about the Turning 22 program, which again, it's really hard to talk about that positive when we can't get enough staffing. Lucy, you've seen the staffing change, and what do you think the biggest factor is besides we having fewer people around? Besides that, what would you say is number one?
Well, I think not paying the people enough to make the kind of people, I guess when I dreamed in the beginning of having community programs, I dreamed of having college educated staff, people who were very well trained and very dedicated and really had the personality that you would recognize as a caretaker kind of personality. And that's the kind of staffing has changed. And the people that are now working are, for the most part, foreign people who are very kind for the most part. I don't think they could be doing this work unless they really were dedicated to the clients. But the issue sometimes is that some people get hired who really don't have the dedication. And I think that's of concern. But when providers are desperate for staff, they have no choice. A body comes along and says they'll take the job. They might take it, but they don't last. They don't realize what they're getting themselves into, because it's extremely hard work.
Yes.
And I'm not the most pleasant work for some people.
Right.
So I think, paying people who are great caretakers is very important. And the provider that I'm involved with has put up extra money that they're not getting reimbursed for, and they are able to retain some staff. But even as they're getting, I believe, close to $20 an hour now. But then there are some people who really aren't happy with that as well. They
Right.
want more.
Right.
And I don't know whether providers can ever really pay them much more because
So
they
that's
don't have the income.
right. So this is what's going on, and we'll talk about this for a minute, since you brought it up. So just in the past months, 5 months, the state agreed to boost the benchmark rate for staff to $16.79 an hour. I might be off by a penny, but it was $15.50 and change, okay, just an hour. Now, what you have to appreciate, that's what the state sets as what they expect on average a direct support professional will be paid. Whether you want to call them direct care or direct support professional, I don't care what words you use. So that means if you're doing it for 4 years, you're in that bailiwick, or if you just started tomorrow, you're in that bailiwick. Now, what providers do with that, as Lucy's saying, they may then end up manipulating that. So some people might get paid less than that $16.78, $16.79 an hour. And by the way, that just happened, and it has not happened for residential yet, but except, I'll get to that in a minute. It's very fuzzy time. But in terms of the way the state sets its permanent rates, so Agency X gets a rate for the residential program or the day service. Part of how they figure out that rate for the hour or the day is how much you have to pay your direct support staff, a nurse, a behavioral clinician, a program director, and those numbers are given to them. So as Lucy's point, since staff tend to be 70% of your costs, right? The salary and the fringe benefits and all of that, you can't pay much more than what the state sets as a benchmark. You can pay whatever you want, by the way. You can pay twice what the state gives you, but you would probably run out of money pretty damn quick if you did. So right now, all programs are getting a 10% boost, but even there, because the legislature didn't vote on the most recent supplemental budget, it hadn't finished it, residential providers have not received the additional 10%, okay? Only day providers have, only family support providers have. Now, that's great, but guess what the problem with that is? If you're only at 50%, 60%, 65% occupancy, you're getting 10% on your attendance rates. You get 10% on what you bill, not on what you could bill if you had 100%. So that has a limited impact, right? So Lucy, if you're saying some people are paying 20 when the rates technically are authorized, even if not in their pockets yet, $1 more, 10% more, it's more than $1 more, 10% more than, what was $15.57, right? So 10% would be like $1.60. So you're easily in the $17 range that you'll eventually get reimbursed for. But I have heard about agencies paying $20, $19.50 an hour. That is not technically in the reimbursement rate, okay? So they're going to try to figure that out, and they're thinking probably their turnover is so bad, they're hoping they'll have enough savings to pay that higher rate. Okay, on the training requirements, you know what I'm going to do? I'm going to show you guys something interesting. I like this page. It's a homespun page in the sense that DDS, it's its own training website because, this, as you may know, the Commonwealth of Massachusetts controls the websites, okay, of the state agency. So the training department has its own website, thank God. And I'm going to show you something because Carolyn asked about training requirements. And I'm going to share with you, here it is. Do you guys see it? Right? The DDS learning page. And then, so primarily they did this because they realized they had state employees, right? That need to be trained, DSPs. The state serves directly 1,000 something people, okay? The providers residentially. The provider system residentially serves about 7,780 people. That doesn't include, I don't think, shared living. I know it doesn't include shared living. That's in the provider system, about 1,450 people. And it doesn't include, I assume, in-home supports. I have to double check that. I'll get that answer. But the reason I think it's 7,782 or some 42, I'm sorry, 7,742 in the provider system, 1,000 and change, say 40 people in the state operated system, is because we were seeing that, right, with the COVID virus and the pandemic, how many congregate living people who lived in congregate care sites. So here's the mandatory trainings they have up here. But then there's also, here's DDS staff, different trainings they can go to. And then there's a provider section. So let's look at DDS. Can you see it as it open up? So there's download mandatory training list, effective January 2020. Is that, can you see that? The new
Yes.
page? Okay. And here's, I don't know if you probably cannot see the provider mandatory training. I'm going to try to go to that. Okay. And share that with you. Here it is. Okay. See it?
Yes, it's up.
Yes.
First aid, CPR, those we know, those are like freaking mandatory for a million years. Okay. We were doing that. We do that when I ran residential services, circa 79, 80, 81. Signs and symptoms of illness. Executive Order 509, food standards. We did not have that one. MAP training. I'm trying to remember. I'm sure we had something like MAP. That's medication administration program training that allows provider staff to give out pills. That's scary during turnover, isn't it? Making sure the right medication gets distributed. Universal precautions that, happen probably post-AIDS. Transmission of communicable diseases training, COVID-19 training, of course. And then there's the human rights, basic human rights, DDS mandated reporter, positive behavioral supports. You get a feel for that? So, that was a good question. These are like required trainings. Fire safety, we used to have to do, explain about getting out at night. We used to have to do trial, how do you get out of a, house in X seconds at 12 midnight. It was brutal. To wake people up, we used to feel bad doing that. So that's the training, and that gives you a little, an answer to Carolyn's question. And that's called DDS learning. Let me give you let me drop it in there. So if you guys, let me go to the home. Well, I'll give you the whole thing, because that'll go to mandatory training for provider employees, but it also then you'll see the basic prefix for the site, which is ddslearning.com. Okay. I sent it to you. Anybody else want to add something in this dialogue we're having and on the workforce? If I confuse somebody with the whole dollars and cents, because remember, we have money from the American Rescue Plan money, that's 10%. That, again, just to be clear, it has not been distributed yet to the entire world of people who serve in our field. Personal care attendants have gotten their increase. That's good news, 10%. And again, that's more, then that brings you more in the $17 range just for the actual reimbursement. And then beyond that, 39 million hopefully will be approved. The legislature has in both budgets, Senate and the House, but it hasn't been formally passed conference committee yet. 39 million to increase for day programs and other services that got rate increases this year to the blended rate for direct support professionals to $16.79 an hour, $16.79 or 78 cents an hour. Like I said, I could be off by a few pennies. That's the ballpark. And then that will happen when the residential services, which, we'll be advocating for, I don't know, what's realistic. It has to be at least 10% increase for the residential rate minimum. It can't, it's got to be that 1679 plus some more. And because it's that bad out there. We also believe, we're going to be releasing this Individuals and Families First supports packages. It's a 4-part thing to increase supports packages for individuals and families instead of just congregate homes being the main catch-all. And we do have supports packages in Massachusetts. We do have people taking advantage of those. And one example of that is self-direction. And then the second piece, besides, workforce, increasing the salaries and the clinical teams. The third piece is ensuring community inclusion. And the fourth piece is using remote technology and other technologies for assistive communication. Because there's a lot of people out there that may have behavioral issues and other issues that people don't understand what they're communicating. And there's a lot we could do there to make that could help also affect the staffing needs. If people's human rights and their personal rights are observed, right? Anything else anybody wants to add? give everybody a minute. Let me forecast. So again, next week, I'm going to have Bill Henning on with us, the executive director of the Boston Center for Independent Living. We're going to talk about civil rights and a lot of the work they do, access work. Bill's been involved in transportation and healthcare access. We're going to talk about those things. And the week after that, we're going to have some people, some of you know, we're going to have Sydney Haddad as a sibling on. We're going to have Kathy Ryan as a parent on, and we're going to have Alice Taylor as a parent talk about the situation in residential congregate settings and sort of what are some ways to address that with staff and leadership at agencies, if things are going even, tougher than you think. But I think Lucy gave us a taste of that today in her comments and Carolyn's chats. So those will both be at noon next week and the week after. And Thursday at noon, we'll have Maura and Ellen get into legislation and stuff. And I heard, for those of you that signed up for the transition conference, all of the recordings are posted now. They just came out. So that's something I'm sure you could find out about on our website. And there'll be, for those of you, I'll give you advance word, it'll be in notes this week, but DDS Learning is going to have a free partnership course on human services, leadership, and management. It's going to be free, 3-credit course. And for those of you that can get to Massasoit, or I'm assuming it's in person, but it could be virtual, it's a 3-credit course starting this spring for free for people that want to learn about management and leadership in human services. And it's a partnership activity with Massasoit College and Community College and DDS Learning. So I'm really excited about that. There's a lot of good work happening in Southeastern Mass, and our Widening the Circle project, friendship project. It's an inclusion project, has been one of the, partnerships in Southeastern Mass. Also includes the Old Colony Y, and where I know they want to do even more. So we'll hopefully want to spread that across the state in terms of partnerships and activities for inclusive activities for people with disabilities. So, we'll keep going at it. And we are working on a session for people with more complex behavioral or medical needs with DDS. And we did have a conversation last week about getting that on the schedule for this month. So anything else before we sign off? I'm going to sign off now. I want to thank you all. Like I said, we had more of a low-key post-Thanksgiving. Hope everybody had a great Thanksgiving, and look forward to seeing you next week. Thank you.
Bye-bye. Thank you.
Thank you. Bye.
Bye.